My name is Jared Moss. I'm a urologist here at Regional Urology, but I also specialize in male fertility. So from Shreveport originally, I graduated from Evangel Christian Academy in 2002 and then went to Louisiana Tech and finished there in 2006. I did medical school here in Shreveport, finished there in 2010. I did my urology residency in Knoxville, Tennessee, and then I did a one-year male fertility fellowship in Northwestern in Chicago, Illinois. I think the biggest thing for urology that I like so much about it is it's got a very nice balance of being able to, the instant gratification if somebody has a kidney stone, being able to get that patient in, get them worked up, get them taken care of, and that patient is instantly happy. But then you also have, women with bladder dysfunction or men with BPH and prostate cancer. There's a lot of medical treatment involved. It's not all surgical, it's a lot of surgery, but you also have this continuity of care where you have this balance between quick surgeries or big surgeries, but then you also have these patients that you can, follow for a lifetime. So you really get to develop some good relationships with patients, which simply put, to me, urology was just a very nice balance, and that's the reason I chose it. Probably the biggest connection for me is just when I started to get interested in going into doing male fertility, I started to realize, my God, so many of my personal friends are struggling with this and going through it. And, a lot of people almost kind of suffer in silence. They don't talk about it a lot, which I think is not necessarily good. And I'm hoping that as people become more and more aware of, as we delay pregnancy and things like that, which is more common nowadays than it was 20 to 30 years ago, that we're seeing more couples struggle with fertility, and it can be a really serious struggle. And I think that it's important for people to feel comfortable talking about it, not only with their physician, but family and friends, and for people to be, sensitive to that. It is a really, really tough issue when couples have been doing everything they possibly can to have a child, and sometimes there may not be an obvious answer or an obvious cause. Fortunately, if we're able to get people in and get them evaluated, there are a lot of things that can be mitigated, and we can hopefully get that couple to have a natural pregnancy as our number one goal. But if not, there are other assisted reproductive techniques like intrauterine insemination or in vitro fertilization, things like that. So even when things can't be fixed per se, we still have a lot of other options on the table. And I think just knowing what those options are and realizing that it's okay to feel stressed, it's okay to have worry, anxiety when you're going through that, and that's very normal, I think provides, these couples a lot of comfort.